I'm going to be focused on talking about when you have a large employer that's going to be subject to the penalty regime. Really what one of the platforms for this Health Care Act is to encourage large employers to provide health insurance. The idea, of course, is to cover more people. The government has seen large employers as a great place for coverage to be provided to a broad group of our population. So there's the first definition that's really important is whether or not you're a large employer. Now, even if you're a large employer, you may or may not be subject to penalties. You'd be subject to penalties only with respect to your full-time employees. So that's an important concept as well. And there's been a lot of confusion, probably rightfully so, about when you're a large employer and when the penalties apply. And I think some of that confusion is centered around part-time employees and seasonal employees because all the hours of your employees are taken into account when you're determining whether or not you're a large employer. So that's, so you would take, and really if you have 50 full-time employees plus full-time employee or full-time equivalent employees, that's going to cause you to be a large employer. I'm going to talk about that in a minute. But what I'm going to talk about now is really the penalty regime that applies. So we're going to assume that we're talking about a large employer that has 50 or more employees and when penalties would apply. Now, as I mentioned, part-time seasonal workers, they fluctuate with respect to their hours, so at some point in time they could be a full-time employee. And for this purpose, 30 hours a week is considered a full-time employee. So as you can guess, sometimes you could have a worker that's seasonal or part-time that would be full-time employee for that week, and some other weeks they may not be. So that obviously is not very administratable. So what the government's done is that they've created some what are called safe harbors. And the safe harbors allow an employer, when planning for who's going to be covered by their policy, to use what's essentially a look-back period. And let me just skip right over to that. Oh, well here. So how the look-back period works is that you look back some length of time, and the employer can adopt what length of time is appropriate. It could be anywhere from 3 to 12 months for current employees. So, and the question they're asking is, over that measurement period, did that employee work on average more than 30 hours a week? So you're taking the aggregate hours for that measurement period and you're making that determination. And if the answer to that is yes, then on a going forward basis for what they call a stability period, they have to be covered by the plan. So it's a fairly straightforward approach. For new employees, the question's a bit different. Obviously, you don't have the history of work that they've done. So there's a question that has to be answered. If it's reasonable to assume that they're going to be working on a full-time basis as of the start date, then you have to treat them as a full-time employee going forward, and they have to be covered by the plan. On the other hand, you may be hiring part-time or seasonal employees, or you may not be sure whether or not they're going to be full-time, and the law allows you then to apply, again, a measurement period on a going forward basis before they have to be put into the plan. Okay, so there's testing periods, and then there's a follow-up stability period during which they have to be covered by the plan. So let's skip to this. So this is ongoing employees. And what you have here is there's really 4 options here, or 4 different scenarios. As I mentioned, on the left you see the standard measurement period. So this is really the look-back period. And again, this is the employer that is looking at their ongoing employees. And an ongoing employee is someone that's worked as an employee for the entire measurement period. So you have, in this example, 3, 6, 9, or 12 months as the measurement period. Now the employer can adopt any one of those. So and the idea is it's whatever is most administratively convenient or makes sense for the employer, that's the measurement period that they would adopt. There's a corresponding stability period. The stability period cannot be less than the measurement period. So as you can see, there's corresponding stability periods. The first example, if you have a 3-month look-back period or measurement period, you cannot have less than a 6-month stability period on a going forward basis. So in that instance, in those, and again on the left, we have 3 months during the standard measurement period. In one case, the employee is treated as part-time, so they would not need to be covered going forward during the stability period. But on the other hand, if they're full-time during the standard measurement period, they would need to be covered during the 6-month period. Okay, so that's how ongoing employees work. And what happens is this is a recurring event. So the standard measurement period begins again after it ends. So if we had, in the first example, a standard measurement period that ran from October 1st to December 31st of, let's say, 2013, our standard measurement period would again commence following that period. So as we go down to the 6-month, 9-month, and 12-month, there's also a concept called administrative periods that can follow the standard measurement period. And the idea there is that the employer may need time to do administration, to enroll employees. Once, well, you know, it's time to gather information, make the determination as to whether they're part-time, full-time, based on the look-back period. And then once they've determined that they're full-time, to get them enrolled into the plan, or at least offer them enrollment, give them notices, that kind of thing. So it's likely that there would be an administrative period that's necessary following the standard measurement period, and it could be up to 90 days, essentially. So you see the administrative periods there. And let's, you know, I think a common scenario is going to be the 12-month standard measurement period followed by let's say a 3-month administrative period, which is the last example. And so what happens there is we have from October 1st to September 30th of the following year, we have our measurement period. We have the 3-month administrative period from October 1st to December 31st, and then we have the stability period. So if during that measurement period the ongoing employees are determined to be full-time employees, they're going to need to be covered during that stability period. Now what happens following the first standard measurement period, the standard measurement period again repeats itself. So it's an ongoing process. So as employees drop out of full-time employment or you add employees into full-time employment, they're going to need to be covered for the subsequent stability period. There would be a subsequent administrative period to get those employees enrolled into the plan. So that's how that all works with ongoing employees. For new hires, it's very similar. As I mentioned, if you have a new hire and it's reasonable to assume they're going to be full-time, they need to be covered immediately, or I should say there's a 90-day grace period to get them enrolled. And if you're not sure whether they're going to be full-time employees, again, it's 30 hours on average per week during your measurement period, or during, I should say, your coverage period. If you're not sure because maybe they're only going to work part of the year, maybe they're part-time, maybe they're not full-time all the time, you have again, a measuring period on a going forward basis. So again, there's flexibility as to what that's going to be, 6 months, 9 months, 12 months. During that measurement period, they don't have to be covered. But again, you need to make sure that you have at least some kind of reasonable basis to conclude that they're not going to be full-time employees when you hired them. I mean, you may not, I should say that in the reverse. That if it's reasonable to assume that they would be full-time employees, then you have the 90-day grace period. But if it's reasonable not to assume that they may not be, then you have this testing period from the start date going forward. Again, you have the administrative follow-up periods and then the stability periods. Okay? So that's really the crux of the process or procedure to determine whether or not you have full-time employees. And again, the key to all of this is that you want to make sure who you have to cover, because if you don't cover the right people or you don't cover enough people, then you could be subject to penalties. And the penalties are based on full-time employees that don't receive coverage. Okay. So, skipping over to the next slide, variable work schedules, I touched on that a bit. There's been a number of guidance or proclamations by the IRS regarding how to cover teachers. I guess teachers is sort of an example of someone that has a variable schedule. They have summers off, they have holidays off, spring break. So if you looked at that, the year as a whole, as a calendar year, they might not be full-time employees. I guess if you do the math, it may not work out to 30 hours per week. But what the law says is that, essentially what it's saying is that if they look like they're full-time employees based on what they're doing, and it's really due to the fact that they're working for an educational institution that has an academic year, that you would really spread the hours out over those breaks, and then they become full-time employees. Commissioned salespeople, pilots. Pilots by regulation really can't work that many hours, so that's going to be something that's going to be addressed. But if a pilot is performing normal kinds of levels of service, just like anyone else who's regulated that can't provide can only provide so many hours of service, I think the government's going to look at that and deem them to be a full-time employee. Commissioned salespeople. The idea here is that a commissioned salesperson may not be working 30 hours a week. Maybe they're working a bunch of hours sometimes, but they're not working that many hours other times. But what's the key here is that the government wants the employer to take into account preparation, travel time, all the kinds of work that's ancillary to the actual performance of their sales activities in determining whether or not they've met the 30-hour per week threshold. So, all that's really to say, if you have someone with a variable schedule, you have to be, from an employer standpoint, you need to be, I think, conservative in taking into account the total number of hours they're actually putting into the job, and not try to be too fast and loose with that, with the idea that you take the position that they're part-time and you don't need to cover them, because I think that is going to be something that runs afoul of what the government's trying to accomplish. Independent contractors versus employee, this is just a historic issue where the government wants all workers to be treated as employees, basically, and a lot of companies don't want to treat their workers as employees because of payroll taxes, workers' comp, a bunch of other costs associated with having employees. And this is another cost. Now you have health care premiums that need to be paid by the employer. The government's using the same test, though. It's a 20-factor test. So to determine whether or not you have an employee versus an independent contractor, the main question with that is whether or not the employer has the right to control the worker. So and you see this really all over the place as well. I think there's a lot of cases in the construction or the contracting industry where contractors are engaged on an independent contractor basis. The government may challenge that because they may deem that those individual workers as being employees because the company ultimately controls what they do. So there could be significant exposure there. Leased employees are generally going to be treated as employed by the leasing company. And temporary staffing agencies, there's been a number of strategies, I'll call them, designed to kind of game the system where you would use a temporary staffing agency to hire workers for part of the time that they work for the company, And what the government has said is if you try to game the system in that way, shift the employment relationship to a temporary staffing agency, that's going to be looked as an abusive relationship, and they're going to ultimately treat the employer or the company as the employer for all those hours. Okay, so again, I think that the theme with all of that is, be reasonable, conservative with your determination of how many hours workers are working, and be careful about independent contractor status, and also be careful about shifting the employment relationship to temporary staffing agencies. Okay, so I mentioned large employers. That's who penalties are going to be imposed against if they're not providing health care insurance to full-time employees. So when do you have a large employer? As I mentioned, 50 or more full-time employees. It also includes a concept called full-time equivalent employees. And so the full-time employees, that's pretty easy to figure out because that's just 30 hours a week on average over the prior calendar year. So if you look at the prior calendar year, the work, and you determine how many full-time employees based on those hours. So in this example, we have 45 full-time employees. Those employees worked an average of 30 hours per week over the prior calendar year. Then we're looking at all our part-time employees, the ones that haven't reached the level of full-time. We're adding all of those hours up among all those part-time employees, and we're going to divide that by 1,560, which is really the full-time equivalent for a calendar year. So in this example, we ended up with 10 part-time employees. And because the reason that is because we have 14,500 part-time hours worked. I'm sorry. Is that?
Yeah, it's correct.
That is correct?
Yes. Divided by 1560, the law applies to them.
Okay, so yeah, my math is not sharp today. Okay, so if you do the math with a calculator, hopefully, then in that example, you would have come up with 9 additional full-time equivalent employees, and you'd be at 54, in which case you would be a large employer and then subject to this whole penalty regime if you don't maintain health insurance for your full-time employees. Okay, so I think what's interesting about that is, and I think there's some confusion around this, is that you take part-time and seasonal employees into account in determining whether you have a large employer, but those same part-time and seasonal employees will not cause you to be subject to a penalty if you don't cover them. So that's, for example, the restaurant industry, they may have a lot of seasonal part-time employees that if you add all of those up and divide by 1,560, you probably have a bunch of full-time equivalent employees. But those same part-time and variable seasonal workers may not need to be covered because they're not full-time employees in and of themselves. So that's important. I'm going to skip that one. Okay, so I mentioned already about be wary of certain schemes to avoid these rules. So as a large employer, what are you going to do? I mentioned shifting workers to independent contractor status. You need to be very careful that if you're going to do that, that you're comfortable with the fact that you have an independent contractor status or relationship versus an employment relationship. I mentioned shifting workers to temporary staffing agencies, splitting up the companies. So this is interesting. So 50 employees is all you need for a large employer. What if you had 75 employers and you decided to split into 2 businesses? Would that work? Well, there's controlled entity rules or controlled group rules that apply. And if the same 5 or fewer owners own more than 80% of different businesses, 2 or more businesses, they're aggregated. So then those 2 businesses, because of that common control, would be treated as one employer for purposes of determining whether or not they're a large employer. So splitting up businesses and having common control doesn't work, shouldn't work. That rule has been around for a long time as well. Government's just really borrowed on what's already in the retirement plan area. So similarly with retirement plans, if you have controlled entities, those controlled entities generally have to cover a significant portion of all the employees of all those controlled entities. Affiliated service groups, this is a very similar concept where you would take the company and you would split off, let's say, a chunk of the employees and put them into a separate entity. But those same employees, of course, provide services back to the company because they're basically workers for the company, or they provide service to the customers of the company. Either way, they're treated as an affiliated service group, and again, they're going to be aggregated for purposes of determining whether or not you're a large employer. And again, if you're aggregated and you're determined to be a large employer and you haven't maintained health insurance, that whole penalty regime is going to apply among those controlled entities. So, okay, I'm going to give it back to John now.